Welcome to the EM Supply Room series, where we teach you everything you need to know to be in and out the supply room for your procedure in 5 minutes or less. An NYU EM APP Fellowship production. The nerves of interest for this video includes the supraorbital, infraorbital, and mental nerves. The supraorbital and supratrochlear nerves innervate the forehead and upper eyelids. Find the supraorbital foramen by palpating the eyebrow in line with the pupil when the patient is looking straight ahead. The notch you feel is the supraorbital foramen. Clean and then inject 1 to 3 mL of anesthetic just medial and superficial to this notch. This is the injection site of interest for the supraorbital nerve block. The infraorbital nerve innervates the lower eyelid, cheek, lateral nose, and upper lip. This nerve exits the infraorbital foramen. Find the infraorbital foramen by palpating the infraorbital rim in line with the pupil when the patient is looking straight ahead. The notch that you will feel is the infraorbital foramen. Clean and then inject 1 to 3 mL of anesthetic just medial and superficial to this notch. This is the injection site of interest for the first approach to the infraorbital nerve block. An intraoral approach is preferred. Inject 2 to 3 mL of anesthesia through the mucosa in front of the second premolar, fifth tooth back, aiming upwards towards the foramen. This is the injection site of interest for the intraoral approach for the infraorbital nerve block. The mental nerve innervates the lower lip, skin of the chin, gums, and buccal mucosa. This nerve exits the mental foramen. Find the mental foramen by finding the second premolar, which is the fifth tooth back. Then palpate inferior to that. To find the second premolar, count backwards, starting with the central incisor, lateral incisor, canine, first premolar, second premolar. Then slide down to find the foramen. This is the injection site of interest for the mental block in an intraoral approach. The other injection site of interest for the mental nerve block is just at the site of the mental foramen. Here is the injection site of interest for the non-intraoral approach to the mental nerve block. We will also talk about supraperiosteal nerve blocks. These are the nerves of interest when doing a supraperiosteal nerve block. These nerve blocks can be done quickly to anesthetize 1 to 2 teeth. Inject 1 to 2 mL of anesthetic in the fold where the gingiva meets the buccal mucosa, aiming your needle towards the root of the tooth. This is the injection site of interest for a supraperiosteal nerve block. The inferior alveolar nerve innervates the entire region of the mental nerve, as well as the mouth, teeth, and half of the tongue. At this nerve, locate the pterygomandibular triangle, which is bordered by the posterior molar inferiorly, the pterygomandibular fold medially, and the coronoid notch laterally. The injection site is about 1 centimeter above the molar. Touch the bone with the needle tip, then back off slightly, aspirate, and inject 2 mL of anesthetic.